Hey everyone, we are on Facebook Live for another session of Ask the Doc. This is the third week in a row now that we've done this, and this is going to be a weekly thing on Mondays at 8. It's a chance for you, the public, to get your questions answered, no cost by a healthcare professional. So what's not to love about that versus having to pay a copay and use a visit and your insurance. So I also appreciate everyone that's taking the time to let me know that the advice that I've given is valuable. That's pretty encouraging just to keep going from here, and awesome that I could help you out in some way, shape, or form. So if you have any questions, don't hesitate to throw a comment in below, and I'd be happy to answer those questions that you may have. So today, what we're going to go over, for those of you who don't know, yesterday was the Grand Rapids Marathon put on by Metro Health. And I was looking to do that, but unfortunately, due to a stress fracture at my talus, which is a part of the foot ankle complex, wasn't able to do that. So kind of a bummer, put in all the miles and just couldn't get it done. Didn't want to risk further injury and that kind of thing. So who knows, maybe next year. But going off of that, now would be a good time, especially for you runners, and whether you did the Detroit Marathon or the Grand Rapids or another marathon recently, and you are wondering, well, what do I do now? Now that the race is over. So recovery is definitely important in making sure that you have a smooth transition from one race to the next or to whatever you want to do next. So that is what we're going to talk about right now. So recovery, especially is important following any event. But in your endurance athletes, it's especially important that for a few things. One, in order to allow for recovery, you definitely need rest. So make sure that you're getting an adequate amount of rest. Make sure you're getting proper amount of sleep, ideally 8 hours a night. And this is a time too to make sure you're getting your proper nutrition and foods. You need to be replacing any fluids that you just lost. Make sure you're drinking a lot of water, getting electrolytes in, replenishing your glycogen stores. So that is the fuel that helps feed your muscles and feed your body. So if you're looking for right after a race or even a run, chocolate milk is one of the best things you can put in your body for that. Not Gatorade, but chocolate milk has been proven to be superior and help replenish glycogen stores and aid in recovery. It's got a good mix of carbs, sugars, fat, and protein to help your body and your muscles recover. So the next thing you want to do, especially if it's following a race, make sure you're getting an adequate amount of protein. You really need that protein to help your muscles recover and strengthen, because when we exercise and put ourselves through an intense workout, essentially there is going to be some muscle damage there. That's what helps get us stronger, and that protein can help to rebuild some of that and aid in recovery, make you stronger, get you prepared for whatever you want to do next. Make sure that you're stretching. So you can, after a race, be doing static stretching if you want to help. That's 30 to 60 second holds. Prolonged stretch, help decrease some of that muscle tightness, improve flexibility. That's definitely something that, I encourage. Then obviously I've recommended before a dynamic stretching routine and warm up prior to exercise. But if you're following a race or event, doing that. So when you're done with what we call the mesocycles, and you've just finished your goal, you've completed the race, and you're probably wondering, how long do I rest? A good, I would say, week, 2 week, 3 weeks can definitely be necessary. And in that time, doing things other than the activity that you just did. So if you're a huge runner and you want to get back out there and run, that's fine, but decrease the miles. Just go on a lot shorter runs. So if you just did a marathon, doing like a sorry, I lost my train of thought. Dog's just eating rice off of the plate off the table. So, so if you are doing a marathon and you just completed that grueling 26.2 miles, taking 2 to 3 weeks off definitely can be necessary, especially after all the months of training that you just put in. And so in that time, if you absolutely have to run and that's what you want to do, shorten your miles, put in, 2, 3, I would say no more than 5 miles at a time. You definitely don't need to be doing more than that. Mix in cross training. So cross training is important here in order to recover and train other motor programs and patterns that your body needs in order to be a good athlete and help train itself. So that can be something as in, playing golf, going and playing another sport, weightlifting, if you weren't doing that previously, which I hope you were for cross training. You don't have to be, but definitely encourage that. Finding something different to do that's lighter in intensity, not super intense. High level, high intensity interval training. I would stay away from that until, your recovery period's done. So some things and myths that are out there, cryotherapy is a big thing right now. We're going to be doing a thing down in Kalamazoo, NovaCare Rehabilitation is, with Steve Leopard, to test that out. But as of right now, the results on previous research studies have shown that it's no better than a placebo effect, but you might feel better right after. So, hey, if it helps you feel better and you think it works and it works for you, I'm not saying don't do it, but I'm just simply saying that the research doesn't necessarily support it at this time. So something to think about before you go and spend a bunch of money. But one of the other things I was going to do, since we're kind of on a running kick right now and talking about running, a lot of people ask, how long should I be in my shoes for? How long should I run in them for? So typically, if you're a runner, staying in shoes for anywhere between 300 to 500 miles is a pretty good range. Every shoe can be a little bit different in how they break down. I would just make sure you're monitoring your shoes and looking at the soles, making sure that they're not completely worn out. Another thing to keep in mind too, where I get patients all the time, they bring their shoes in and they're working out in them, and I take a look and I'm like, how old are those? Oh, they're like 2 years old. Way too low. That's too old. So 6 months really is when you want to change them. Some people go a year. If you're a heavy runner, I definitely don't recommend running in shoes for a year. If you're light on them, maybe, but if you're starting to get foot, ankle, knee problems, do yourself a favor, invest in yourself, spend the money, get a good pair of shoes. Make sure that the shoes that you get are comfortable for you, because that is the biggest key in orthotics and in footwear. Is wearing something that is comfortable is going to help improve your ability to not only run quicker, but to be safer too and help avoid injury. So that is definitely something to think about for you runners out there. And also, if you've got a pair of shoes that you've been working out in that's over a year old, 2 years old, take those, throw them in the trash, go out there, get some new ones. If you're in the Grand Rapids area, you've got 2 excellent stores in both Striders and Gazelles that you can go to. And if you're on the east side, go check out Red Fox. My buddies Nick and Jesse they do a phenomenal job. So I couldn't speak more highly of them. If you really want to go, you don't know what you're doing, go into Red Fox if you're on the east side in Fenton, Michigan. talk to Nick or Jesse, and they will definitely hook you up, and you won't be disappointed. So, yeah, that is that. If you have any questions, please put them in the comments below. I'd be happy to answer them after this if you do have any. And next time, we will be on again next Monday at 8 p.m. If you want to message me any questions too for that one, feel free. I will see you all then. Have a good Monday.